Good morning, Dylan. I'm Nathan Powers. I'm your student physical therapist assistant today. How are you doing?
Doing good. How are you?
I'm doing good, thank you.
Like if you have
So
a
it looks
family
like
member
we
or
got you in
something.
here for some back issues. So what we're going to be doing here is we're going to be giving you a full back massage today. So the purpose of what we're trying to do here is we're just trying to relax those muscles. We're going to try to be increasing blood flow in the area, reduce swelling if you have any. This could also help prevent future injuries. It'll all be inactive. Maybe loosen some scar tissue, although we won't be going into too many deep techniques today. It'll take about 15 to 20 minutes. Do you have any questions about the treatment? All right, so I got a few questions for you before we can begin. So just answer as honestly as you can. Do you have any personal history of cancer? Okay. Any cardiac conditions I should be aware of? Okay. And like whenever you're in the shower, do you ever have any impaired sensations in your back in the region I'm treating? Nope. Okay. Are there any impaired circulation issues that you? Okay. Blood clotting? Any history of that? Nope. Okay. Have you been ill or had a fever recently? Okay. Any history of hypertension, blood pressure? Okay. And so the lubricants we're going to be using is lotion, oil, and potentially cocoa butter if needed. Most likely not cocoa butter. Are you allergic to any of those?
No.
Okay. All right. I think we should be good to begin then. So any questions before we start?
No.
All right.
So,
What's helping her?
Feel this. All right. So what I'm gonna have you do is I'm gonna have you
So if
lay
you want
down.
to do
So I have you
supination,
in on that right
where do you
elbow.
need to have her start?
Shoes. You want me to take your shoes off?
no, you don't.
Alright. So I'm gonna go and have you lift your feet up for me. I'm gonna put a bolster underneath for them, help keep your spine neutral.
Right.
Alright, you good to relax your feet? Feel
And
good?
she's
Yep.
using her
Alright.
supinators against gravity.
Let's see. This is already a little bit.
So we'll start in this position with your palm down.
Put
and
our
then
sheet
go
over
to
you.
that halfway mark, okay? And then go back down. There you go. One,
Alright. And I'm gonna throw a pillow underneath your stomach here to help keep your spine more neutral.
Okay.
And now that she's done a couple, you
Can
want
you
to
lift
ask
up
her,
for me?
does that seem pretty easy? Is it challenging?
Disaster.
is that way challenging for you, is it?
There we go.
Alright.
Yeah, that's better.
It is challenging?
Alright,
Okay.
feel better? Feel more comfortable? Okay. Alright. So I got a towel to dap off the lotion and the oil. Alright. I'm gonna tuck this towel into your pants. I'm gonna go and expose all the landmarks. I'm gonna start up top. I'm gonna get the chromium process exposed.
A little slower, is it getting fatigued? Yeah.
I don't have to worry about
9, is it in the 1?
fraud or anything. So
10, okay, I'll let you
I'm
rest.
going
Good
to
job.
tuck this into the side so it doesn't fall off. It's not completely exposed to the side. Alright, so I'm about to pull your pants down a little bit, okay?
Alright.
I'm gonna expose what's called the gluteal crease, which in layman's terms is just the top of your butt crack. No better way to put it.
Sounds good.
So starting in that.
So I'm gonna tuck the towel so I don't get any lotion on his pants or his underwear. Gonna expose the gluteal crease. Alright. So what we're gonna do is we're gonna start off with effleurage. The pressure is light to deep. I'm gonna go and do 2 pumps of lotion and a little pump of oil. Hands over here. Alright, so my hands are probably gonna be a little cold whenever we begin doing. So to begin treatment, I'm gonna go and have you take a deep breath in for me. And on the exhale, I'm gonna begin the massage, okay?
That's good, that's what we want.
On the exhale,
And that's set number 2.
so we're gonna start light pressure,
See how many we can get in this next
Go
one,
on.
and then we'll move on to the next exercise.
get lotion.
Alright, so you can say her 30 seconds.
Very light pressure.
She's fatigued out.
Okay.
I'm gonna be trying to keep my fingertips.
Okay, so we're gonna move on to the next exercise. We'll also use the 1 pound and then.
Normally I wanna use more fingertips, but I need more lotion now. The
Down,
back
So,
absorbed a lot more lotion than I
the
thought.
last one you started here and you went
So I'm gonna
up.
keep a hand on the
So now we're gonna
patient,
start
just so he's comfortable with my touch.
Okay? Now it's the glass.
Whenever I do this initial effleurage stroke, I'm going to use my fingertips, try to feel for any nodes of tension, any muscle knots, and just try to feel out the back.
How does that feel? Pretty easy.
So go light to deep. Going slightly deeper now. Before we go any further, I'm going to go and raise you up a little bit. Is that okay with you?
Yeah.
Alright. So now we're going to go into some effleurage strokes after the initial effleurage. I'm going to start off with, I'll do a bilateral tree stroke to start things off. So that's with the thumbs. Pressing in, decent amount of pressure right along the paraspinals, and circling back using the shoulders. Let me try doing 3 of each stroke.
Does that feel a little harder?
Is that okay, pressure Dylan?
Yep, let's go a little deeper.
Go a little deeper, okay. Try not to use too much thumb here. Is that deep enough or you want me to go deeper?
Yeah, that's
Slower, getting harder. Okay, let's try for one more.
Try to go all the way up
6. Okay.
into the occiput. And effleurage back down,
Fatigued out.
Okay.
and start another stroke.
Alright, well those are all of the tests I have for you today and exercises.
Whenever I try to
We
circle,
will
I try to
get started
use
out so you can
my
do that
shoulders
at
to
home.
circle, my arms rather than just my
And then
thumbs.
at home, if you don't have dumbbells, anything like household, like a can of beans or anything that is around the same weight as the dumbbells that we use here will work perfectly fine. Okay? But that is all I have for you today. Do you have any questions for me? Okay, and then do you know when your next appointment is?
And whenever we get up towards the neck, I'm forced to use my thumbs more to circle just because it's a smaller area.
Good.
Effleurage
Another
back
good
down.
thing to do in the home exercise program, like you told her, there's gonna be a printout for her to take with, but in your note, it's good to be able to document.
Is it good pressure,
what the
Dylan?
patient
Yep,
showed
you
on
can go
her
deeper
scale
if you want to.
and the HTP, and the best
Alright.
way to do that is to have them,
Doing my
repeat it
best to
back
go
to
as
you.
deep
Not have
deep
her
as I
go
can
through
for
the
you.
whole thing, but have her say, okay, I'm gonna take the weight, I'm gonna hold it here, I'm gonna go halfway.
Okay.
I'm gonna try to do 3 sets of 10, but quality reps. Same with, and then you say, okay, how are you gonna do it this way? I'll start this way, and go, that way.
Effleurage
You can
back down.
document in the note that
I'm going to get more
you
lotion.
instructed them and they've repeated it back to you, showing
Oil.
that they understood how to do it.
Okay.
Yeah.
Alright.
Yeah, good, so.
Next I'm going to be doing shingling.
Yeah, a little
So that's
shady.
just pretty much the same as an effleurage treatment, but instead just do 2 hands like it's like a shingle,
Oh no.
a continuous motion,
Yeah.
But once you set it, it
all on
correlates
one side.
with
Right.
the gravity.
Right,
going
yeah,
back
so
and
with
forth.
strengthening, when you're using a weight or something, you just wanna make sure that gravity's not helping them. Like,
Yeah.
always kinda look at the motion that they're doing, is gravity helping them do that, then
Yeah.
you need to change it up,
Yeah, and that's why I like using the resistance rings, so I don't have to worry about it. But
Right.
since it was like
All
only
the
a 4
occiput.
minus out of 5.
You can either shingle back down or you can just effleurage back down. I'm just going to effleurage back down.
I mean, a yellow TheraBand is pretty lightweight too, so that would've been appropriate also.
Yeah.
Yeah, that is the nice thing about TheraBand is you don't have to worry about the gravity position.
Yeah.
Okay,
And
pressure on the lower
never-
back.
Like, I don't think we've worked with the therapy and the supination pronation anyway, so I think I would have been a little bit confused
Yeah,
with
yeah.
that too.
So those are all things that you want to practice for sure, because like this didn't tell you what to use, but sometimes it might, like in a practical setting, it might say using TheraBand.
Go on effleurage back down. So do one on the other side real quick.
Never tried it with
Right.
TheraBand.
Yeah.
So kind of test everything out ahead of time. All right.
Does it feel okay?
Yep.
Upload your notes Blackboard, and did you write down your long-term goals already? Or do you need this?
I'll get more lotion. Alright, the next technique I'm going to be doing is knuckling. It's a deeper technique.
So this is what.
Start off with your knuckles on the lower back, and as you go more proximal to the neck, you begin to flatten out. You start using your pips and then potentially your dips once you get to the cervical region. Is that okay pressure? You want more pressure?
Yep, this is good.
All right. Slide more to the pips, and now I slide more to the dips to get up in the neck. And with all effronage strokes, take it to the occiput, to the acromion process, and effronage back down.
Yeah, so she got one that, it's instructing for lead resistance, so, some get UCP class, move on from both forecast, into, some of the, 3 plus 4 minus 4.
Do one more. Raise you up a little bit more. Effronage back down. Alright, I'm going to do the 3-stroke trap, which is hitting all parts of the trapezius, starting with the lower, then the middle, then the upper trap. Both sides. Acromion, and then the occiput, the acromion process. Yeah, if you want to move your arms, you can go and do that. Okay. So lower trap, middle trap, upper trap. Try to keep it a nice, smooth, continuous flow. Middle trap. Does that feel okay? Good pressure? Alright, you gonna do the other side? You gonna get more lubricant?
Okay, ready when you are. Do you have your assessment manual? I do.
And upper trap. Do one more on that side.
So.
Lower trap.
I don't need to ask that.
Middle trap. And upper trap.
Can I see her colored one?
Okay. Alright, so last, just finish off effronage. You're going to be doing horizontal strokes.
Yeah, you're feeling busy today.
Going to lower you a little bit. And try to squat down and squeeze the patient.
Hi, Emily. I'm Lauren. I'm the physical therapist assistant today. And
So it feels good for the patient, it's easier for the
I have a few
clinician.
questions to ask you first. Okay. So, how are you feeling today? Okay.
What's my time at? I know I got 23 minutes of space on my phone.
So
You're at
I'm going
13.
to
Thanks.
take your blood pressure before we start. But I want to ask you.
Once
more
you get up in the
questions.
cervical
How is
region,
your
instead of
pain
using the
today?
whole
With
hand,
your right elbow.
start to use fingers.
Okay,
Start to
what
use
would
2
you give it
fingers,
on a
but still
number
try to do
from
the same
0 to
concept.
10, 0 being no pain, 10 being emergency room. While you're resting.
Go all the way up to the occiput.
And what about when you're active?
Use a horizontal stroke down as well. Does that feel okay, Dylan?
Yep,
A 6. Okay.
Alright. You want more pressure, more squeeze, or is it fine as is?
this is good.
Okay.
I think it's like right elbow triceps, like cervicular.
Yeah, so like reaching out for things.
Oh, okay. Yeah, so like reaching in the top cabinet.
Doing your hair.
Doing my hair, washing the hair, and stuff. Okay, and are you on any medication?
Not any prescribed, but sometimes if it gets bad, I take ibuprofen.
Alright, so before we get into your manual muscle test and your strengthening exercise, I'm gonna take your blood pressure.
Okay, that's about it today.
You're the first unlucky one today that had a significant
Alright.
past medical history that you had to do an assessment for.
Okay.
sure that I didn't miss anything?
I'm gonna do your
Alright.
right arm.
So next we're gonna do petrissage strokes. So we have 2 of those. I'm gonna go ahead and take a towel, dab a little bit of the lotion oil off his back, just because we need more friction for this stroke. Need to pick up more skin.
Yeah, all I had to do was respiration.
Feeling okay, Dylan?
Yep.
Alright. So for the first petrissage stroke, we're just gonna be doing the double J. It's in the mid to lower back. This is where we're gonna focus. We'll be picking up tissue and kind of doing a little figure 8 with our hands. I'm gonna raise you up a little bit here. Feel okay, Dylan?
Yep.
Okay. Alright. Stop when we get towards the upper back and then go back down.
Does that feel tight enough on your arm right there?
Do one more on this side.
Yeah, honestly, your cuff is a little bit low. I'd probably go a little bit above the.
And we're trying to pick up the tissue here.
Time getting your stethoscope where you want it to be. If you
It's a
go
little
there,
bit
free it.
less glidey than an effleurage stroke. Do the other side real quick. Feel okay, Dylan?
Yep.
Okay. Alright, now I'm gonna do the C stroke on the traps. So, gonna be
Should I get a different one?
pretty much just wringing out the trap more or less, going back and forth with it with the 2 fingers. I'm gonna try to go all the way up the trap here. How's that feel, Dylan?
Good.
Really trying to work that trap, really trying to grab into it. Get your release, relax.
Okay, how does that feel?
Yeah, that looks better.
Go down one more time on this side, and I'll do one rep on the other side as well. Or one.
I noticed that. I was just gonna try to shove it up his there. That's not the best idea.
The other side.
Okay.
Sometimes that's a little pinchy for the patient, and, get down too far.
How's it feel over here?
Good.
Okay.
You'll be the pro at testing blood pressure.
Hopefully.
Practice.
I'm gonna do one more. All the way up the trap
Righty tighty.
It's like,
and back down. Alright, so to end the treatment, I need just a little bit more lotion and oil so I can finish with some effleurage going deep to light. I'm just going to do 3 strokes here. Start off semi-deep. Go up, back,
I got like 122
indicate to the
already.
patient that the treatment is almost
I
over.
saw it around 115, so we're kind of.
Can I try it again?
Yeah. What do you usually run about?
Go very
Yeah.
moderate to light pressure.
Okay.
The occipital out of the traps neochromium process. And then for the last stroke, just a very light stroke.
Okay. I saw like 115 over 75 that
Yeah.
time. Okay. So, I mean, the blood pressure is good. Maybe a
Alright, Dylan, feel good?
Yep.
Should they drink
Alright.
some water?
So I'm gonna go ahead and go ahead and get the oil and lotion off your back. I'm gonna pat it up instead of rubbing so I don't irritate the skin.
Theraban we're gonna use for your strengthening exercise. So could I have you take your watch off?
Back feel okay?
Yep.
Alright.
But could I have
I'm gonna
you-
go ahead
Could I
and
have you?
on
Could I have you
towel.
move your chair out just so?
Pull his pants up to a more comfortable position.
So for this, manual muscle test, I'm gonna have your right arm. In the motion, I want you to
Tie it
do
up
is
for
just,
him.
and then can you class on resistance. Just try to resist against me.
So
Slide.
before you apply resistance, you want to.
Halfway.
There you go.
I'm gonna lift your feet up.
Slide.
I'm gonna take off the bolster. Make it easier for you to stand up.
So
And I'm gonna
do
go and
three
lower down your
plus.
plinth for you.
Okay.
Gonna write that.
Won't move yet.
So since it's a 3+, I think I'm gonna try the yellow band first.
Yeah, I just give it here.
Alright, take it all the way down. Alright. So I'm gonna have you scoot your abdomen up for me if you can. I'm gonna get the pillow out of your way. Alright. I want you to roll to your right. So you're facing me.
Yeah, a little bit more.
Get the shoe out of your way for you.
So
Alright, go ahead and swing your
I
legs
was
over.
thinking
Pop up on
of
your.
doing, having her arm
Just go ahead
up
and
and I'll
sit
be
there for
behind
me.
her while she's pulling up.
So from here,
Okay.
Work your
just wait for the patient
That could definitely
to
work.
seem much less hazy.
Since this one is telling
with you, and then from there you can
to
end your
instruct her in
treatment.
this for HEP.
So you have any questions for me, Ms.
What
Franklin?
might you want to do instead?
Alright, thank you very much.